So many people are looking to live happier, more stress-free lives. We provide interviews from mental health experts across various fields because we know finding quality information isn't always easy. Let's find more sanity together. Welcome back to our second episode on parent-child interaction therapy. This episode is going to focus on PCIT for older children. You probably were just listening to the last episode, but just in case you weren't, we have Dr. Kate Gibson and Dr. Corey Lineman, who are both experts in parent-child interaction therapy. So just to get started here, the phrase older children, what do we define as being an older child?
So for the purposes of this adaptation, we're talking about kind of middle childhood where standard PCIT leaves off at age 7 up through about age 10. So through the end of elementary school is about what you're looking at, mid-elementary to late elementary school.
And then we can use it for even older children, especially kids with developmental delays who are still going to be enjoying some of the activities we do in the beginning that is for relationship building, and who are more appropriate just from the parent's perspective to use some of the discipline strategies that we recommend.
So this is newer on the block, right? So how long has this protocol been live for?
So the manual has been available for 4 years, I think, at this point. And Dr. Cheryl McNeil and Tony Hembry-Keegan wrote a book about parent-child interaction therapy. In that book, this was much longer ago, in that book, they had a chapter about how to use PCIT with older children. So that is where the manual came from, was trying to take that chapter. So many people in clinical practice were trying to take that chapter and use it. So we wanted to give them a roadmap of how to do that so that we could be more certain that people were doing it the same way and having sort of fidelity to the way that it was being administered. So it is still being researched. It does not yet have that research support that standard PCIT does, but we're very hopeful that we'll be able to continue to expand the research and get some good results.
And just because we were talking about effect sizes last session, how is I'm not sure how much research has been completed and what has been found, but do you guys have a sense of what's going on there?
So we have very little research, but after I answer this, I'm going to let Dr. Lineman speak to the research that she's getting started with it, because she's taken the lead on some of the things that are to come. So far, we just have an outcome study with cases from the manual authors and their trainees, so a small sample of 22. And we have strong effect sizes, but it's a small sample and it's not randomized, and it's all developers of the manual who, are invested in getting these families through. But we did see a significant decrease in ECB scores, which is the assessment measure that rates problem behaviors. And we did see a significant increase in the pride skills and a significant decrease in those don'ts, which are the same as in standard PCIT, the avoiding questions, commands, and criticisms. So we're excited about those initial results.
Okay, very cool. Everything has to get started somewhere, right? So, I mean, it sounds like the work is going on. So, Corey, what work are you doing?
So I just have a small grant, and I am in the data collection phase. So I don't have any numbers for you now, but we are just putting the protocol in place and collecting some information from the typical protocol, like we would with the IBERG Child Behavior Inventory, to measure disruptive behavior. We're measuring parenting skills, negative parenting skills, and we're looking at some additional measures in my study, some things with irritability and emotion regulation, treatment satisfaction, and things like that. So it's very exciting.
Okay. Just a very quick recap. Just in case you're just tuning into this episode, PCIT is a therapy originally for 7, right? Below 7.
2 to 7.
3 to 7. Yeah, 2 to 7. That's meant for defined behavior, but there has been adaptations to use it for children with anxiety, selective mutism, and all sorts, a host of conditions. It is very effective. The numbers show that it's very effective. And it's broken down into two modules. One is the child-directed interaction, and the other one is the parent-directed interaction. The child-directed module is to start connecting the parent's attention to being very reinforcing for the child, building the relationship, making it more positive. So when we get to the parent section where we actually start putting on commands and then taking away that attention, if the commands aren't being met, it's actually meaningful and something reinforcing is either given or taken away, which is the parent's interaction and that, I don't want to say relationship because relationship's still there, but the attention from the parent. Is that a pretty good nutshell
that's
summary?
A great summary. Yep. And we run into that a lot in the parent-directed interaction phase, where we remind people that we are not ignoring a child. We are ignoring a child's behavior. So there are ways that we teach where we can, if a child whines and argues with you to do something, you can still interact with that child, but you're just not going to respond to that behavior to do that thing that they want you to do if they're not saying it in a respectful way.
Mm-hmm. Okay, so in what way? So let's start in the child-directed interaction part of it. In what ways is the older child protocol different than the OG?
So we still are going to be live coaching. We're still going to be focusing on those same pride skills, praises, reflections of the child's words, imitation in the play, describing their behavior, enjoying the interaction. But we're going to have a broader variety of praise at play. So as kids get older, they don't want such a hyper focus on all of their behavior. So they still respond to positive attention from their parent, but we want the wording to be a little more varied. So we're going to encourage parents to have some specific praises and some more general praises. We're going to encourage also nonverbal praises. So gestures, thumbs up, high fives, cheering motions, just more of a variety of how they're showing their praise. In terms of the reflections, that's where a parent repeats or paraphrases what their child is saying. As kids get older, they don't want you saying exactly what they say. So they might bristle a little more at that. So we're going to have parents be a little more summarizing or paraphrasing in how they're reflecting what their child says, or wait until the child says a few things and then kind of give a shorter, brief summary of what they just said. They're going to be imitation is pretty much the same. They're going to be using the same toys as the child is, the same activity, but they're not going to do whatever they're creating exactly the same as their child. And I think a big difference is when it comes to the descriptions. So in standard PCIT, we want parents diving in, focused on that kiddo, describing, what that kiddo is doing with their actions, being that sportscaster play-by-play. As children get older, like I said, they don't want that hyper focus on themselves. They want more mutuality and back and forth in the interaction. So we have parents do what we call self-descriptions, where it's almost like a ping-ponging back and forth. The parent might say, oh, I'm going to add some purple to my bracelet. I see you've picked out blue and yellow. I think I'm going to add a second color also. And so the parent's talking about their own actions or thoughts in relation to the activity they're doing. And then focusing on what the kiddo is doing with a nice kind of back and forth. And we still want that kind of E for enjoy in there. So in terms of the actual pride skills, those are some of the nuances and how we're having parents adjust or caregivers adjust what they're doing with kids who are just a touch older.
Yep. And then I don't know if you mentioned, but we are extending the time. So typically we're doing 5 minutes of interaction, but in the older child protocol, we're having families sit together one-on-one, I guess, with the child for 10 minutes, just because if you're getting out a more complex activity, say you're working on building a really complicated marble run, 5 minutes is not that much time, and the kids can get frustrated with that. The activities can be a little bit more open-ended, so I tend to see families doing more involved, possibly messier things that you might not want to attempt with a 4 or 5-year-old, stuff like glitter glue, paint, where the child can be trusted to kind of keep it clean, more complicated building toys and things like that. pride. So pride skill adaptations, a little bit longer, little bit more, a wider range of activities. I'm trying to think if there's any other adaptations or changes to CDI that we haven't talked about yet.
Along the lines of slightly more complex toys, they might even be putting something to the side and bringing it back. So like continuation of a project across days of special time also. So, and just trying to hone in on what the kiddos' interests are, but still stay in that creative, non-rule bound type of activity for that CDI phase.
And I guess we can mention too that the don't skills, the avoid skills are the same. So we're still coaching parents to avoid asking questions, avoid giving instructions, and avoid criticizing their child's behavior during the 10 minutes of special time.
And so the benchmarks to move on to the second phase are slightly different, given that as kids get older, they don't tolerate as well that high rate of talking from the parent. There's a little more time for allowing for thought process and play. So the pace of talking is a little slower. So therefore, the number of skills that we're looking at them demonstrating when we're kind of counting their skills at the beginning of the session is a little lower. So in standard PCIT, we want them to have 10 labeled praises, 10 reflections, and 10 behavior descriptions with no questions, commands, or criticisms in that 5-minute period. And for kids who are older, we're looking at 7 praises, at least 4 of them labeled, 7 reflections, 7 descriptions, at least 4 of them about the kiddo that are behavior descriptions of the child, but 3 of them could be those self-descriptions where the parent's talking about themselves. But we still want those don'ts as close to 0 as possible.
So you're moving the needle with the and this is going to be a no duh comment, but with the maturity level.
Yeah, exactly.
So we don't want kids to feel like you're treating me like a baby. Why do you keep saying I'm doing a good job? Because that's going to be more negative than positive.
Because we still want to build that warm, enjoyable relationship. So we're trying to keep as much of standard PCIT there that has this great evidence base as possible, but make developmentally appropriate adjustments, as few as possible, to maintain that child's interest and motivation in spending that time with the parent.
And I think it really helps parents to be able to join in their kids' play again. Lots of little kids need constant attention, and so you may really be familiar with what your child loves to do, but as you get to be 9 and 10 years old, parents tend to spend less time sitting on the floor, getting down on a child's level and playing with them because they're more self-sufficient. So it really helps them reconnect and learn how to play with their child again.
Are video games allowed, or is that a no-no?
They're discouraged, but
we get asked that a lot.
Yeah. So I think you ideally want something where they're interacting and you can still talk about what the kiddo's doing. So I think some people can do that with any activity. And if we can find something that's a little easier for the parent to achieve using those skills, we'd rather they do something where it's going to be a little easier for them. But if the only thing the kiddo wants to do is video games, we can start there and support the parent in how to nuance these skills into that interaction. It's just going to be harder.
Yeah. And then the other thing that I think about with video games is there's not a lot of face-to-face interaction. So if that's a tool that the parent can use to reinforce the child's behavior, and we want the parent to get really good at turning their facial expressions on or off when we later on get into therapy pieces where we're trying to underreact to things, they're just not getting that practice in. So it's not ideal, but it's better than not being able to do the interactions at all.
What about like going outside and hitting baseball, throwing football, doing frisbee? Would that activity be okay because it's more
I love that you said going outside. I personally think that is a fantastic option. we use the analogy of a sportscaster for the behavior description. So I think those are great options. It just needs to be in a situation where you're not concerned about safety. So if your child routinely, uses bats to torture you and the other kids in the house, we're maybe not going to start with baseball. We want it to be a non-aggressive activity. So if it's something they're going to engage with in a positive way, or they're highly likely to engage in a positive way, and you're doing it in a place like outside where it can be done safely, I think it's definitely in the array of options.
Yeah, and I always encourage families to judge distance and how close you are together. If you're throwing the football far enough that you can't really see each other's faces or hear what each other is saying very well, lots of times people will say, well, does bike riding count? And it's just harder because you tend to be farther away from each other. But things like shooting hoops, playing catch, I even in clinic, I have like a little... what do they call it? Trash-get ball, like those trash can basketball, or the Velcro mitts with a tennis ball. Because, some kids, they just love sports. They love to be physically active, and we can definitely make that work.
And that's great. I mean, it's great to reinforce. I mean, that's a whole nother topic, but getting kids to actually be physically active is getting harder.
Yep.
And physical activity is very good for kids and adults.
Yes, and it is very easy to get a lot of behavior descriptions. Like if you have a dad and a son and they are playing catch, you are going to get all your behavior descriptions because it's literally your sportscasting.
Okay, so it's increasing the time, 10 minutes, having less verbal utterances. I don't know if that's the way to say that, just so the kid is not getting annoyed.
Pace, yeah.
Slower pace. And the activities could be more complex, and it could be bridged from the last time where you bring back out that Millennium Falcon Lego set and you keep, I'm a sci-fi nerd. So.
And a little more just involvement about what the parent's doing. In younger kids, it's very focused on what the kiddo is doing, and it's more of a back and forth here.
Okay. And it's still what the kid wants to do.
Yes.
Child-led. Yep.
Okay. Any other major changes in the child-directed module?
Well, just to kind of clarify, it's still what the kid wants to do, but within standard and within the older child adaptation, we do encourage the parents to put out the options so that your 5 minutes is 5 minutes or your 10 minutes is 10 minutes, and it's not 20 minutes because it was 10 minutes of picking the toy. So we encourage the caregivers to pick, 3 different options, have those things ready, and then the kiddos picking from those kind of pre-orchestrated options of things that are high value and high interest to the kiddo.
Okay. Moving over to the parent-directed section, what is looking different on that side of it?
Yep. So in the parent-directed interaction in standard PCIT, it's really just one phase. And in the older child protocol, we break it down into 3 mini modules. And our biggest goal with that is to gradually, just like in standard PCIT, gradually introduce this listening skill, this controlling my body when I am upset because I have to do something I don't want to do, like brush my teeth. And we are dealing with children who are bigger physically. They are smarter in terms of working the system and finding loopholes, and they are more entrenched in these patterns of power struggles. They've been engaging with these power struggles for a long time, and so they tend to get more explosive and get there faster. So when we put in these 3 little modules, we're trying to build skills along the way to avoid physical interactions, number 1, and to avoid big emotional explosions so that the child is more bought in the whole time. I guess we didn't touch on this for the CDI, but it's across the board that we do have a check-in with the child individually so that we're building rapport with the therapist, because again, these kids are older, so they're understanding that we're meeting here and my parent is talking with this other adult and we're doing things a lot differently. And so they can feel like everybody is against them or we're trying to manipulate them or gang up against them. So throughout the entire therapy, especially in the PDI, though, we spend 10 minutes speaking one-on-one with the child, and then we spend 10 minutes speaking one-on-one with the parent. So they're able to talk about some of the issues that are going on. And we kind of try to get their buy-in. Hey, can you help me? Because I really need your parent to practice this homework. And do you think you could do this for me? So that's a big piece of it too.
Because we are still live coaching and they're older and they know their parent has an earpiece and they know we're talking to them. So if we didn't build an individual relationship with them, it would be really hard to have this go smoothly.
Yeah, so they know. I mean, we let them test out the walkie-talkies and we show them. They usually think it's pretty cool. So none of it is, we're doing this behind your back and it's a secret. We're all pretty much on the same page. But back to your question about the PDI. So the first mini module of parent-directed interaction with older kids is we want the child to learn to accept timeout, because in the younger standard protocol, we are physically putting a child on a chair if we need to, setting them down, and then if they get off early, we are physically putting them into their room and holding the door shut for 1 minute. These kids, lots of times we physically can't pick them up because they're too heavy, and if we did, they could become physically aggressive, and it's just not a situation where we feel like it's safe or productive. So we want to teach the child to choose to stay in the timeout chair if earned of their own accord. And
that's the first timeout module, but we actually start with commands prior to the
I'm getting ahead of myself. Yeah, go ahead. You can introduce.
I'll do command training, and then you can take back over for the timeout acceptance chart. So we start without timeout with older kids. We start breaking up the pieces of the discipline a little more. The first module of PDI for older kids is what we call command training. It's those same exact 8 guidelines for giving effective commands that we talked about in regular PCIT. But the difference is we're not instituting a timeout yet. We're letting the parents kind of get competency over giving good directions before we get into instituting timeouts. So we teach them those guidelines for giving effective command, and then we do what we call a big ignore as the consequence for that module, which is them basically telling the child that if the child doesn't obey, that the parent is going to turn and ignore. If the child obeys, they get their positive reinforcement. If they do not follow the direction, the parent turns and ignores for 45 seconds. So attention shutdown, no verbal facial interaction, nothing's coming from that parent for 45 seconds. And then after that, that is the consequence. It's like a mini time out from your parent's attention without you having to walk anywhere or do anything. It's completely in the parent's control. They can remove their attention without their child having to do anything. So they're learning to give a consequence that's within their control to give. They're learning to kind of follow a script to give good directions. And what the child is learning before we're putting an expectation on the child to do timeout, the child is learning, my parent is saying words, and then my parent is doing what they said. So they said they're going to withdraw their attention, and then they're withdrawing their attention. So they're seeing their parent be consistent and predictable with a consequence when they don't quite yet have the expectation themselves as the child to do anything. So it's a nice shaping step that helps them sort of ease into this discipline phase. And I myself was skeptical we would see much change in this phase when I first started doing this, but you have to remember, you've done a whole child-directed interaction phase before you get here. So kids are motivated for their parents' attention. So we often do see that kids will adjust their behavior just from their parent turning and ignoring for 45 seconds. But like we talked about in the last episode, we're starting with low-hanging fruit. We're not going to say, tell your child to keep their hands to themselves after they've hit their sibling and then just turn and ignore for 45 seconds. Like, that's too big a behavior. We're going to start with very easy, high likelihood that the child is going to do it anyway commands, and we're going to use this big ignore for those. But we're starting out with real life commands rather than in the play. So we're starting out with real life commands with older children, but still with very low difficulty ones.
Okay. And so after that, it was the more so doing the command. Oh, sorry, Corey, what were you talking about before that was the second stage?
Yeah, so once they are accepting this big ignore, this mini timeout, which really they have no choice to accept because it's, like you said, all in the parents' control. And once we're coming back and parents are saying, oh yeah, that they're pretty much doing all the little things that I say. And even if not, I am following through with the consequence of turning and ignoring. And yeah, we warn parents that it's probably not going to, quote, work. But it's just a placeholder for what is going to work. And so the next step is we want to reinforce and reward a child for accepting a timeout where the child has to physically go to timeout. So we use the same timeout procedure that we use in standard PCIT. There's a chair. It's a 3-minute requirement to sit, and then they have to follow the original command to end the timeout. So instead of having a backup for that where the child has to go to their room for a minute if they choose either not to go to timeout or if they get off early, they have a sticker reward chart system. And so the consequence for either refusing to go to timeout, because like we said, we can't physically make a 10-year-old go to a chair if they are choosing not to. So either they refuse to go or they refuse to stay in the chair and finish and follow the original command, they will lose their sticker or their star on their chart. And then that corresponds to a daily reward and a weekly reward. So we'll set a quota collaboratively with the child and the parent. How many stickers for the 7 days of the week is your goal? And so your child can earn a bigger reward. And so the kids get really excited about earning rewards, and we try to make it easy again. We try to make it doable. So you don't have to listen to every single command right away. But if you do earn a timeout, you have to finish your timeout and then do the original command in order to earn your sticker for that period. So they get excited about the prizes, and then we try to get them to a point where they are accepting a timeout. They're listening most of the time to the commands, and if they're not, they are accepting the timeout and complying with it, and they're learning a lot of self-regulation by doing that, and then we can move on to the next phase.
Why stickers now and not in the younger protocol?
Yeah, great question. I think so. Younger kids, we can pick up and move around, and so we have a little more flexibility to shape them sitting in the chair in a different way without having to introduce a different type of reinforcement system. So like Dr. Lineman was saying, as kids get older and smarter, we can't get as physically involved with them. So we're trying to, and they have the cognitive savvy at this developmental level, most of them, to be able to understand that they can work for something and delay gratification a little more than a 4-year-old who's like, sticker, what? Like, I just, that conceptually is a different story if we're talking about a 4-year-old and an 8-year-old. So if we have kids who we can't move and who don't understand reinforcement systems that are a little more complex as well, that do understand them a little better. This is a way for us to motivate them to cooperate. So like Dr. Lineman said, it's not that they don't have to get a timeout. They get a sticker either because they followed all the directions or because they cooperated with their timeout. They went to the chair safely. They stayed in the chair. So we're teaching them that they are capable of following directions and they're capable of on their own sitting in a chair and cooperating after that. So that there's more motivation on their part to work at doing the thing of the behavior of sitting on the chair.
Yeah, and our sticker chart, again, like we talked about with the check-ins, helps them stay bought into this treatment, because the parents having to bring their child into therapy sessions, and if the child's really not bought in and there's nothing in it for them, it's hard to keep that going. So they get super excited about earning these prizes. And then another reason that we don't use it for younger kids, because we don't need to, because the treatment works without it. And it's another step and it's complicated. I don't know about you guys, but I know with my kids personally, sticker charts is just one more thing to remember. You got to either buy a prize or remember to administer a prize, like extra time on your electronics or taking your kids somewhere. It gets to be a burden. I think a lot of parents communicate that stuff to me. So if we don't need it, we don't need it. But in this case, we need it for just a short period of time. That's the other thing. We're not going to expect you to put your child in a sticker chart for the rest of their life.
Do they get to buy things with the stickers, or is it just the sticker in itself?
So there's a reward menu.
What is usually on the?
See, you're already bought in. You want a sticker chart.
I want a sticker. I want a Mr. Bear. I mean, if you're watching video, Mr. Bear is very big in the PCIT community. I'm learning. So what are kids earning usually from these sticker charts?
I mean, it could be so many things. It could be a piece of candy, extra 5 minutes doing an activity they like. So there's a small daily reward, and then there's something bigger they're earning as a weekly reward if they're able to get that number of stickers. So a bigger weekly thing could be a small toy or an outing somewhere that they want to go. We try not to have only things that require purchasing on the reward menu.
Yeah, we can be really flexible with it because cost is a big thing. Cost and convenience of just having to go out and buy more and more things is important for a lot of families. So it's amazing what kids will get excited about. We have lists of examples, and sometimes it's just like playing tic-tac-toe with dad is the most exciting thing I can pick on here. And then older kids get really creative. So a lot of them want money to the PlayStation store or Robux to play on Roblox. And so you can give those in really small increments, but that might be something that they never get otherwise. So they'll work really hard for it. Privileges like having sleepovers, staying up late on a certain night. So I usually let the kids kind of drive that bus, and then we just say, parents get the ultimate say. We come up with a long list, and then we highlight ones that parents approve of. So it's a really fun session.
I didn't want to derail in the middle of it, but the Mr. Bear thing, what are you doing with these teddy bears in like, what is it a tool to do?
So I use them for role play. A good session in PDI is every session. So if you don't get a timeout because the child is listening to every command, well, that's a win. But if you do get a session where the child earns a timeout, then you get to coach the parent through that. So if they're just not getting, and a lot of these older kids, they know I'm being watched, I'm in the clinic, I'm on my best behavior, and we hardly ever get a timeout for some kids. And so we use Mr. Bear. And so the kid likes to play Mr. Bear and control him, and we'll say, Mr. Bear, hand me the block, and Mr. Bear says, no, I don't want to, and chucks the block. And so then we have the bug in the parent's ear, and we coach the parent through saying the script and picking up the not picking up the bear in the older child protocol, but administering the statements about what you're going to lose your sticker, and you're sitting quietly on the chair and all those things. So I use it for role play a lot.
So it's almost an easier way for the child to digest what the learning is, because they might not be doing it directly, but Mr. Bear is doing it. So it's a less. I feel like it takes away the power dynamic, struggle dynamic when it's Mr. Bear. There's a barrier between I'm being told what to do, I'm learning it through this third party.
Absolutely. Yeah. They're older and smarter than kids in the 2 to 6 age range, but they still really just buy in when it's happening to Mr. Bear and he's having problems listening and he's sitting on the chair. It's very removed, and they often don't make that connection.
So will you like sit down and say, like, this is the new principle we're introducing? Will you role play it with the bear, as the bear being the child, so the child could see what's going on, but it's not them?
Yeah, I think we definitely, for kids who are engaged with Mr. Bear, will use that as a tool. It just depends on the kiddo. I might not use Mr. Bear every time, but it's definitely a good tool. I think the other thing that happens in this module that's different is we teach some steps for accepting timeout also to the child. And so we role play that with them, and we might use Mr. Bear in that too, or we might just role play it with the kiddo, but we teach them, taking a breath, saying encouraging statements to themselves, like reminding themselves that 3 minutes is not that long. So there's several steps that can support them accepting timeout that we teach to them in the coaching modules, in the coaching sessions of this timeout acceptance chart module, so that they're also learning that they have some control over their thoughts when they're in timeout, their actions when they're in timeout, and they're learning some coping tools for being able to accept that process also.
Okay. Are there, I'm assuming there's particular phases with that ramp up, the time, the shaping timeout, like what are the particular phases within that?
Yeah, so we have the big ignore phase where we're just turning for 45 seconds and ignoring, and then we move up to we call it the timeout acceptance chart, which is the sticker chart for either following directions or sitting in the chair. And then the final piece with shaping timeout is the timeout with suspension of privilege. And in a nutshell, we are replacing this sticker chart with global suspension of privilege. So we'll sit with a family and come up with what are their most reinforcing activities that we will basically shut down until they accept their timeout. And so I always say, your child still gets to eat, your child still gets to sleep, they get to go to school. We're not trying to do anything horrible and outlandish here. Usually electronics, families say, okay, no iPad, no phone, no gaming system. Sometimes it'll be special outings, like if there is a sleepover planned or they want to have a friend over, those things will get shut down. Sometimes they'll pick another favorite toy, like, oh, he's working on his big Lego creation and that's going to get paused. Sometimes it'll be special treats like desserts or soda or something that they really love and look forward to. But the cool thing about it is that the child is totally in charge, and we talk this up with them in our individual check-in, that you get to decide. Lots of kids get grounded from things for a week or a month, and you get to decide how long, and they'll say, oh my gosh, so I can get my video games back whenever I want. Yep, whenever you want. And when you are ready to accept that timeout, you sit for your 3 minutes, you do what your parent originally told you to do, boom, all the privileges are restored. It's not, now you get to play video games all you want, but the privilege is available if you would normally get it. It is open to you.
Oh, very cool. And that's very reinforcing to listen to the command, because you have control over getting back what you want at any time that you want it. The parent is not saying, oh, you lost it for 2 hours.
Yes. And
exactly.
Right,
and they don't lose the privilege unless they choose not to cooperate with timeout. So if they cooperate with timeout, they still maintain all their privileges. This is just the backup to help them stay in the chair and a step out of a sticker chart.
Okay. Yeah. And I understand, like, just like we were talking about ramping up the commands, ramping up the timeout, because if you were to just hit them with the restriction of privilege, I can imagine explosiveness potentially, or acting out behavior or anger, things like that.
Yeah. And now, and they've lived it. So they've probably done several timeouts up to this point, and it's been more positive. They've lived hearing all the commands and the protocol and the scripted statements that their parents are saying. And so it's almost like an exposure as well as shaping. They're used to, I was upset. I didn't want to follow that direction. And then I sat in the chair and it really wasn't that bad. It was boring, but it wasn't impossible. And I find when I'm doing this with families that kids are very rarely waiting more than 10 minutes to get their timeout over with. It kind of times out with like physiology of being upset with something, and then they'll just kind of cave and get it over with. And so when you said you don't have to ground for 2 hours and that it's more palatable to the child, that is true. And for the parent, sometimes when a parent gets really upset and frustrated, you pull something out and then you regret it because now I have to entertain my child or just deal with their behavior for the next 3 days of this weekend because I took away electronics. So it removes the temptation for the parent to pull out a random consequence that they haven't thought through, and it removes the hassle of having to enforce that for a long period of time.
And one thing in this there, and probably, I mean, for working with children, is that getting the buy-in. You're always working on child buy-in into the therapy, because the more that they are bought into it, the less resistance there's going to be. And I think that's great for, so if you have a parent that had been taking things away for a set period of time, and you tell the kid, well, by doing this therapy, you could actually get your stuff back quicker. I can imagine getting pretty good buy-in to being like, sure, I'll do this therapy. I get my stuff back quicker. So it's nice that there's that dual process going on, and several of things that you have talked about in this therapy to get that child buy-in while also it being therapeutic.
Yeah, so we try to have them tie the restriction of privilege just with this as we're going through therapy, because if they're then losing video games for some other behavior on the side, then it gets a little bit murky in terms of our behavioral effects, and it gets confusing for the kid. But yep, we often will say, isn't this amazing? You never, ever have to go to timeout again if you don't want to. You will always get the opportunity to hear the warning statement, and then you get to choose, would I rather go to timeout or would I rather do this command first? And the same thing with the privileges. You get to decide how long this lasts.
Is there still the house rules without the warning? So it's not a free punch or
Correct.
whatever it might be?
Yeah, we still have those same elements of, we introduce PDI gradually, but once they're accustomed to timeout, then we introduce a house rule if one is needed, in terms of a behavior where they would go straight to timeout because it's never acceptable. We can do sibling sessions later in PDI, just like we do with standard PCIT, go out into public and practice handling behavior in public if we need to, just like we would do in standard PCIT.
Okay. Any other major changes in the older child protocol that we didn't hit on?
I would say the thing that surprises me the most about this is when we switch from sticker chart to restriction of privilege, it seems like, oh my gosh, you're taking away all of my prizes and now you're taking my stuff. But it shocks me how much these kids are just like, okay. And sometimes I'll do the analogy of like, oh, when you were little or your younger sibling, they probably got like a candy or some type of a sticker for going poop on the potty. And do you get those still? No. And so we kind of equate that with like a little kid thing, but they just really go for it.
Isn't it amazing when you learn like a therapy technique and you do it and you have that, wow, it worked moment? I remember the first time I did an exposure. I think it was like for social anxiety or something. And I was like, wow, they habituated, like their emotion went down and it worked. And we had a great conversation afterwards. And it's really nice, like these moments when you're learning to do therapies.
Yep. And I will also say too, to reiterate, I don't know if we touched on it at the last episode, but the graduation criteria are, you've got to hit your CDI, so the pride skills and the avoid skills, the goal criteria in that coding session. So the 5 minutes of coding. Then you've also got to be coached and hit your criteria with the follow through. So the way that you're stating the command and either giving it a specific praise or following it with the warning statement and the consequences in the exact way that we teach it, up to 75%. We will accept 75% correct follow through. And then you've also got to have a parent who is saying to you, I feel confident doing this on my own. I understand it. I can do this. I don't need any more therapy to help me master this model. And their ECBI scores, the Iberg Child Behavior Inventory scores that rate the intensity of the disruptive behavior, have to be at a normative level. And so we're graphing that over the entire treatment. So once we get those three things, the parent skills, the parent confidence, and the child behavior, then we know that they're ready for graduation.
Okay. If people are looking for the treatment manual or the resources that are available for the older child protocol, where can they go and find that?
The manual is available on Amazon. It's called Parent-Child Interaction Therapy Adapted for Older Children, a research development manual. And the Kindle version is free, and I think the paper version is around $25.
Okay.
And then you have a website also. correct?
Yes, that is true. It's the website is geared towards therapists. It's PCIT for older children.com. We have all the handouts from the manual are on the website, so you can print them pretty instead of trying to like smush your manual in the copy machine. And there's links to some lovely videos that Dr. Lineman made as demonstrations, which are very helpful tools. And we have links to PowerPoints that therapists can use when they're doing the teaching sessions with the families.
And so you should be able to, if you are trained in standard PCIT, you should be able to buy this book and understand how to do it. There is no formal, maybe I'm misspeaking, there is no formal PCIT older child protocol trainings at this point, correct?
At this point, I think our priority is getting research support before doing like structured dissemination. But people do have access to the manual if they're trying to implement it on their own. It's a step above people trying to implement it off the chapter because now we have, this manual of how to do it in a structured way. I do offer consultation groups for people who are certified therapists who are trying to implement the adaptation because it's tough to do if you don't have the standard PCIT foundation.
Mm-hmm. And I said it in the first episode during your introduction, Kate, but you are the co-author / developer of this manual. So you're hearing it, what's the phrase, from the horse's mouth or whatever, like this is the real deal.
Yeah. The ideas came originally from Dr. McNeil, who Dr. Lineman has referenced a couple times, and she is one of the co-authors also. And we're trying to just give it as much structure as possible so it can be researched and implemented with fidelity.
Amazing. Well, thank both of you so much for coming in to not only educate us on the original PCIT protocol, but also the older child protocol. I think there's going to be a lot of people interested, and through it was a PCIT International. You can find trainers and trainings and resources. So definitely go check that out if this speaks to you and it's something that you want to get trained in or get more involved in, or if you're a parent listening and you want somebody that could help you. Apparently there's also a roster on there too. Anyway, thank you both so much for coming on.
Thank you for
having us.